You might have something inside your body right now that is silently destroying your sperm. No pain, no symptoms, no warning. And the odds are, nobody has ever checked. It's called a varicocele. Yes, a varicocele. Now that's a word most people, never mind most men, have never heard of. And most won't know whether a varicocele is an illness, a symptom, a condition, or a problem. It affects up to 40% of men with fertility problems. And the vast majority of those men have absolutely no idea it's there. Not your GP, not the fertility clinic, not the internet. Because when you search male infertility, you get articles about doing squats and going to bed earlier. Today we are fixing that. By the end of this video, you will know exactly what a varicocele is, why it matters for your sperm, how to get diagnosed, and what your real options are. No fluff, no filler, just the information you should have been given a long time ago. Let's go into it now. So what is a varicocele? You know what a varicose vein in your leg is, right? You've seen them, those twisted, bulging veins that push up under the skin. They happen when the valves inside the vein stop working properly. Blood that should flow upward starts to pool and back up. The vein swells, it twists, it bulges. A varicocele is exactly the same thing. Bluntly put, it's a varicose vein in your balls. Same mechanism, same root cause. Valve failure, blood pooling, vein enlargement. Just in a very different location, with very different consequences for your fertility. Inside your scrotum, running alongside each testicle, is a network of veins, called the pampiniform plexus. Their job is simple. Drain blood away from the testicles back up toward the rest of your body. When the valves in those veins weaken, blood stops flowing upward efficiently. It pools, the veins enlarge, they become twisted and engorged, and the testicle sits there bathed in backed up blood it was never supposed to hold. Now here's something important about where varicoceles form. Around 85% of cases are on the left side. This isn't random. The left testicular vein drains into the left renal vein at a sharp 90-degree angle, creating more resistance to blood flow. The right side drains more directly into a larger vessel, so it handles the pressure better. The left side doesn't. Varicoceles are graded on a scale of 1 to 3. Grade 1, small. Only detectable with an ultrasound. You can't feel it. You can't see it. Grade 2 can be felt during a physical examination. Grade 3, visible to the naked eye. Some men describe it as feeling like a bag of worms on the left side of the scrotum. Not pleasant to find, but important to know about. Here are the numbers that should stop you in your tracks. Varicoceles are found in roughly 15% of all men, but among men being investigated for infertility, that number climbs to 35 to 40%. That is not a coincidence. That is a pattern. So the question is, why? What is it about pooled blood in a vein that can wreck your sperm? The answer is more damaging than most men realize. Stay with me. Here's what you need to understand about your testicles. They are temperature-sensitive organs. This is not a trivial biological detail. It is the reason your scrotum exists outside your body in the first place, to keep the testicles a couple of degrees cooler than your core body temperature. Sperm production requires that cooler environment. Take it away, and sperm production suffers. When a varicocele causes blood to pool, that backed up blood raises the temperature inside the testicle. We're not talking dramatic increases here. Even a rise of 1 to 2 degrees Celsius above optimal is enough to disrupt sperm production at the cellular level. The cells responsible for making sperm, Sertoli cells and Leydig cells, are exquisitely sensitive to heat. Push their temperature up slightly, and they begin to malfunction. Sperm production slows, weakens, distorts. But heat is only part of the problem. Pooled, stagnant blood carries less oxygen than blood that's flowing properly. This oxygen deficit creates oxidative stress in the testicular tissue. Free radicals, toxic, unstable molecules, begin to accumulate, and they attack sperm DNA directly. We are not talking about vague, theoretical cellular damage. We are talking about sperm with physically fragmented DNA strands, sperm that cannot fertilize an egg properly, or that results in early miscarriage, even when fertilization does occur. And there is a third mechanism. Varicoceles drive up levels of reactive oxygen species in the testicle, toxic molecules that attack sperm membranes and the mitochondria inside each sperm cell. Mitochondria are the engine. They power the tail, They drive forward motion, damage the mitochondria, and you get sperm that are slow, weak, or completely immotile. Sperm that cannot reach an egg even if everything else is working perfectly. The cumulative result is this. Men with varicoceles consistently show lower sperm count, reduced motility, higher rates of abnormal morphology, and elevated DNA fragmentation. Every single parameter that matters for fertility, damaged. And the damage is progressive. The longer a varicocele goes untreated, the worse it gets. If you've had a semen analysis come back with low count, poor motility, or elevated DNA fragmentation, and nobody has mentioned varicocele to you, pay very close attention. To the next section. Here is the brutal reality about varicocele symptoms. Most men have none. No pain, no discomfort, no visible change. Nothing that would prompt you to walk into a doctor's office and say something is wrong. Some men do experience symptoms, a dull ache or feeling of heaviness in the scrotum, particularly after standing for long periods or after physical activity. Some notice a visible bulge or that distinctive bag of worms texture on the left side. But for a significant proportion of men, especially those with grade 1 or grade 2 varicoceles, there is nothing to feel, nothing to see, no clue whatsoever. This is exactly why varicocele remains one of the most underdiagnosed conditions in male reproductive medicine. It doesn't announce itself. It just quietly does its damage. So how do you find out if you have one? There are two routes. The first is physical examination. A urologist or andrologist examines your scrotum while you're standing upright and asks you to perform the Valsalva maneuver, which means bearing down, like you're straining. This increases pressure in the veins and makes any enlargement significantly more detectable. It takes minutes. It costs nothing. And it is startlingly underused in standard fertility investigations. The second, and the one you should push for, is a scrotal Doppler ultrasound. This is the gold standard. It does two things. First, it measures the diameter of the veins. Anything above 3 millimeters is considered clinically significant. Second, the Doppler component detects reflux, the backward flow of blood that confirms the vein valves are failing. That is the definitive diagnostic moment. Reflux confirmed, varicocele confirmed. If you have never had either of these investigations done, and you are dealing with fertility issues, you need to ask for them, by name, because they are not automatically offered. You have to ask. Quick pause. Before we continue, here's something worth knowing. If you've been feeling frustrated or even embarrassed about changes in bedroom performance, sensitivity, stamina, or desire, you're not alone. And it's not your fault. There's a 100% natural solution that's already helped thousands of men feel confident and energized again. No pills, no injections, no procedures, no surgery, no risky shortcuts. Just a simple, easy home remedy you can make at home, designed to support what researchers are now calling the manhood molecule, a key factor for arousal, blood flow, and lasting power. Find out more. There's a link in the description and in the pinned comment. Check it out. It could be the very thing you've been looking for. Okay, let's get back to today's topic. Now, the question every man in this situation wants answered. If I have a varicocele, can treating it actually fix my fertility? The evidence says yes. Here's what the research shows. There are 3 main approaches to treatment. All of them aim to achieve the same outcome. Stop blood flowing through the damaged veins so the testicle can cool down, recover, and get back to producing healthy sperm. Option 1, surgical varicocelectomy. This is the most widely performed procedure. A surgeon makes a small incision in the groin or lower abdomen and physically ties off the affected veins. Blood is rerouted through healthier surrounding veins. The procedure typically takes 30 to 45 minutes under general anesthetic. Recovery is around 2 to 4 weeks. The evidence behind this procedure is substantial. Multiple large meta-analyses, studies that pool data from dozens of individual trials, consistently show that varicocelectomy significantly improves sperm count and motility in men with confirmed varicoceles and abnormal semen parameters. A 2021 meta-analysis found that surgical treatment increased natural pregnancy rates and improved outcomes for couples going through IVF, where the male partner had a confirmed varicocele. This is not marginal. This is meaningful, measurable improvement. Option 2, percutaneous embolization. For men who want a less invasive route, this is worth knowing about. An interventional radiologist guides a thin catheter through a vein in your neck or groin, threads it all the way to the testicular vein, and deploys a small coil or sclerosing agent to block the vein from the inside. No large incision. Local anesthetic only. Recovery of 1 to 2 days for most men, and outcomes comparable to surgery for the majority of patients. Worth asking your specialist about if the idea of surgery gives you pause. Option 3, watch and wait. Not every varicocele needs treating. If you have a grade 1 varicocele and your semen parameters are within normal ranges, active surveillance without treatment is often the appropriate call. The decision to intervene should always be based on 3 things: the grade of the varicocele, your current semen analysis results, and your specific fertility goals. A good specialist will walk you through that decision clearly. Now, one thing every man needs to understand before they go into treatment with unrealistic expectations. Sperm take approximately 74 days to fully mature. That is the biology. You cannot shortcut it, which means that even after a completely successful procedure, you will not see the full improvement in a semen analysis for at least 2 to 3 months. Most clinical studies measure outcomes at 3 to 6 months post-treatment. Be patient. The improvement is coming. It just runs on biology's timeline, not yours. Here are the 4 steps to take right now. Concrete, actionable, in order. Step 1, get a clinical semen analysis. Not a home testing kit, a full clinical analysis at a certified laboratory. You need count, motility, morphology, and specifically ask for DNA fragmentation testing. That last one is critical and frequently left off the standard panel. Ask for it by name. Step 2, see a urologist or andrologist. Not your GP alone. A specialist in male reproductive health. Request a physical examination of your scrotum and ask specifically for a scrotal Doppler ultrasound if there is any clinical question. Do not wait for it to be offered. Ask for it. Step 3. If a varicocele is confirmed and your semen parameters are abnormal, have a direct conversation about treatment. Ask about surgical varicocelectomy versus embolization. Ask what the evidence shows for your specific grade. Ask what the expected timeline for improvement looks like. Get specific answers. You are entitled to them. Step 4. Support your sperm health in the meantime. Avoid heat to the groin. Hot tubs, laptops on your lap, tight underwear. All of these raise testicular temperature. Exactly what you don't need. Add CoQ10, zinc, and selenium, antioxidants with solid evidence behind them for sperm health. Cut smoking, reduce alcohol. None of this replaces treatment, but all of it gives your testicles the best possible environment to recover once treatment happens. Let's bring the whole thing together. A varicocele is an enlargement of the veins inside the scrotum, the same mechanism as a varicose vein in your leg, but located where it can do serious damage to your fertility. It affects up to 40% of infertile men and produces no symptoms in the majority of cases. The damage it causes through raised testicular temperature, oxidative stress, reduced oxygen supply, and direct sperm DNA fragmentation is well documented, measurable, and progressive. Diagnosis requires a physical examination and ideally a scrotal Doppler ultrasound. Treatment, through surgery or embolization, has strong clinical evidence behind it for improving sperm parameters and real-world fertility outcomes. And the timeline from treatment to measurable improvement is a minimum of 3 months, because that is how long sperm take to mature. If you have had an abnormal semen analysis and nobody has checked you for this, now you know exactly what to ask for. If this video gave you something you have never heard before, share it. Not for the views, because right now there is a man watching his partner go through another round of IVF who has a varicocele sitting undiagnosed in his scrotum, and nobody has told him. That man needs this video. Subscribe for more content on male fertility that actually goes this deep. Real mechanisms, real research, real options. And drop a comment below. Have you ever been checked for a varicocele? Yes or no? I want to know how wide this knowledge gap really is. Now watch this video where I reveal the 3 everyday, ordinary foods, found in most kitchens that produce lots of sperm in men. It will shock you, but in a pleasant way.